I'm Dr. Marlene Siegel. I'm going to show you a more tangible way to see what it is that we're creating with this technology. And it's no longer a question about whether or not we can get rid of some of these toxicities. It's really about how are we going to mitigate it. And that, I think, is going to be what's going to take us into the future. We can get rid of the things that we can get rid of, but we're not going to get rid of glyphosate. We're not getting rid of 5G towers. It's here to stay. We all have the cell phones. So we have to find these safer and more effective ways to mitigate the effects that this is having on our bodies, on our pets' bodies, and even on planet Earth. So I'm going to do this through live blood analysis. But we talked about why these red blood cells are so important in order to deliver oxygen and get rid of waste material when they can use their surface area. This is a condition called rouleaux. And I never really understood what was causing this. And Dr. Winter and I were taught that rouleaux is normal in horses and cats. And I will tell you emphatically, it is not. In fact, I posted a case in a technician group and some guy actually made the comment, oh, rouleaux is normal in cats. And I'm thinking, wow, a belief system? Yes. The truth? No. Because I can make this go away in a multitude of modalities in horses and in cats. So it is not normal. This is even worse than rouleaux. This is almost called aggregation. And those are all supposed to be nice round blood cells. And you can see that they look more like cuboidal crystals and not a real white blood cell. So now we're going to show you a couple of cases. This is a person who I did a study for a company and they were wanting to see what the baseline was. We literally tested the person to make sure there was no EMF exposure at the moment I drew the blood. And then we took a fan that had a USB piece to it. So it had a lot of EMF and we exposed the person. We drew the blood at that point, and then we gave them an EMF protection device. And 20 minutes later, we drew the blood again. So baseline, no EMF exposure, exposed them to the fan, and then within 2 minutes we took the blood and looked at the differences, and then we did a protection, and then we did the blood 20 minutes later. Her baseline, really cruddy looking blood, and it turns out she actually had cancer at this time. And then we exposed her to the EMF, and you can see her cells in the center. So in the middle slide, you can see like her, she really crushed that 4th phase of water. And then we did the protection and her blood was able to separate out decently. So it was better in each one of these cases, it was better than where we started from.